Back in 1998, a son's promise to his dying mother led to the founding of Cancer Treatment Centers of America. Today, CTCA has become a major force in leading cancer care outcomes, hospital ratings, and patient satisfaction. Today, we welcome Kristin Darby, Chief Information Officer of CTCA, to our show. She's going to share their unique model of culture, engagement, patient experience, and the recent transformation of their care pathway and workflow. If you're still with us, it's because you are with us, right here on Red Hot Healthcare. Let's go.
3-1 and 21 and north. All engines respond.
This is Red Hot Healthcare. Interviews with today's leaders and all the news that matters. Here's your host, Steve Ambrose.
Hello and great to have you aboard. I'm your host, Dr. Steve Ambrose. For past and upcoming episodes, find us on iTunes and most podcast directories, or on our eye-catching website, redhothealthcare.com. Since 2014, Kristin Darby has served as CIO at Cancer Treatment Centers of America, a direct-to-consumer network of adult treatment facilities with hospitals in Philadelphia, Tulsa, Atlanta, Phoenix, and Chicago. She's strategist and architect for their information services and informatics programs, leading initiatives around precision medicine and value-based care. Separately, she's an inventor and a U.S. and European Union patent holder for a patient safety and education system used at over 300 outpatient dialysis clinics. Kristen, great to have you, and welcome aboard Red Hot Healthcare.
Thank you, Steve. I'm very happy to be here with you today.
I know the audience is going to absolutely love this interview today, and it really brings in a lot about patient experience, culture, a bit about consumerism, and let's start it off a little bit with your visionary leader, Richard Stevenson, if we could. He founded CTCA back in 1988. He believed that cancer care and the cancer patient experience needed to be greatly improved. If you could, Kristen, I'd like you to jump in and share with our audience some of the company's statistics and strengths that happen in patient engagement and experience.
Absolutely. As you mentioned, the organization was founded out of a promise Richard J. Stevenson made to his mother when he was losing her to cancer. And one of the things he recognized in that process was he was not satisfied with how she was embraced in that process around being educated about her disease, understanding options she had available, and really being empowered with choices around how she was actually going to embrace her cancer journey. And so based on that, CTCA was founded. And patient experience and engagement are really centered to our model that delivers what we've established as our core care delivery philosophy. It's called the Mother Standard of Care. And it means exactly what it sounds like, which is we deliver care in a way that you would want your mother to be treated, or any of your loved ones, family, friends. We try to make sure everyone in the organization understands and embodies the Mother Standard of Care, and that's how we interact with our patients within our environment. That truly patient-centered approach has resulted in us being ranked in the 97th percentile among U.S. hospitals for patients who give their hospitals a satisfaction rating of a 9 or 10.
Yeah, I know that you guys are one of the most admired hospital systems in the entire United States. And I mean, you're not a large system, but the fact of the matter really is I don't think that's really been your model to be one of the largest systems, just one of the systems that does things and does them well.
Absolutely. One of the things we're very conscientious of on a regular basis is we don't want to push growth in a way that would take us away from our core principles and philosophy of the personal touch and approach that we have with our patients. You mentioned around the recognition of our brand is a survey that we were honored to be recognized in from YouGov Brand Index, Best Brand Survey, which just a few years ago was extended to healthcare. But CTCA was ranked number 7th most positively perceived brand in America. as a company that helps people and families battle through a very difficult healthcare challenge. And that's really centered to what we want to be recognized for as an organization.
Yeah, one of the real big buzzwords today that I know, Kristen, you're so aware of is consumerism. It's buzzing everywhere. Really, one of the things about CTCA, one of the aspects that I liked about it, even going back a bit, years before I saw some of what CTCA was all about, and that was about consumerism even before its time. So now we've got a lot of health systems and hospitals scrambling because deductibles are going up and patients are having to pay more of the bills, so it's more reactive. And I think really that your organization, not just from its beginning, but all the way through, recognized that importance of really centering on the patient, centering on the consumer. I'd like you to touch just a little bit more on that, if you could.
Absolutely. Consumerism was really revolutionary when CTCA was founded. And that patient-centric culture was really built around the fact that we truly understand that patients have a choice when selecting a healthcare provider. And based on that, we want to make sure that they always feel value in the care delivery that we're providing and as part of the relationship that we have with them. Healthcare is very personal, and every individual's journey is unique, especially when they're battling a disease such as cancer. And so based on that, when we look at the truly patient-centric approach, we understand that the choice every consumer or patient within healthcare is making relies on different factors. And that enables us as an organization to understand that we must prioritize the relationship that we build so that it's personal with those patients. We get to understand them and we understand what's important to them and what they value. And then we make sure our model is able to adapt in a way that enables us to deliver care in a way that's going to be most valuable for them, really creates the hopeful, compassionate, and healing environment that we want to provide to all patients, but does it in a way that consistently lives up to the mother standard of care.
Yeah, you know what I like too, we talked about this off air, Kristen, was the patient-centric culture that you have. A lot of it comes from your investment, from CTCA's investment, real heavy in recruiting the people that work for the organization. I'd like you to talk about that a little bit, about your culture, about how important recruitment is, and just how everybody really is on the same mission.
They have really created a unique culture that not only exists at each of our sites, but it's consistent across, which is very hard for organizations to do. I believe that that's been established and sustainable over the years of CTCA's existence through the heavy focus on recruitment of, as you mentioned, we refer to our employees as stakeholders. And that's really focused on aligning to the values of the organization and finding individuals that at all levels and in any job, whether it's actually at the bedside or it's a supportive function, administrative function, et cetera, that everyone within the organization is responsible for the experience that that patient is having, and that we all contribute to creating the hopeful, compassionate, and healing environment that we want our patients to experience as we're delivering the mother standard of care. And that often extends the recruitment process for many months sometimes, for both the organization to get to know that prospective stakeholder and for them to learn about CTCA and really determine if that is going to be a long-term fit. We're looking for individuals that truly are going to emotionally connect to the mission of the organization and supporting our patients rather than looking at this as a job.
I mean, look, when you talk about an engaged culture, right, and we're just starting to learn more about this in healthcare because we're having to. You've known about it for years at CTCA because you've embraced consumerism. But when we get down to it, it's not about everybody being friends. You don't have to be friends with everybody that you work with, but everybody has to feel valued. Do I have that right?
Absolutely. We believe not only in patient engagement, but high employee engagement. And, the higher the employee engagement is, it drives that emotional connection to the organization and the mission. People feel empowered within their job, and they tend to hold themselves to a higher standard of delivery in a way that is truly unique in the CTCA culture. And it's intoxicating when you come to the organization and you experience it. You start to understand why the patient scores around our satisfaction levels are as high as they are. It's been very, very consistent throughout the history of CTCA.
So we talk about culture, Kristen. We're talking about getting purpose in your team. Working at CTCA now, what are some of the lessons that you think other healthcare systems and services could learn from what you're doing?
So I think as healthcare looks and from a technology perspective, we tend to always be a lagger in adoption. With the shift to consumerism that's occurring in the not only healthcare industry, but all industries, you're seeing a lot of very rapid reactions of other healthcare providers that are not necessarily or don't feel to be aligned to a very clear digital strategy. So it's creating a lot of clunky solutions. And I think from CTCA's perspective, what I've really learned from that, and being someone that's tried to implement many of these solutions at other healthcare providers prior to joining the organization, is that you really have to have that solid patient-centric core around the culture that you deliver healthcare in. And then the digital solution becomes a complement to that, where it wraps around that truly healthy core so that you can create a consistent experience and continue to nurture a relationship with your patients that's bidirectional when they're not inside your facility. We know more and more care is becoming virtual. And so all of us are having to learn how to extend the relationships that traditionally occurred in person into a virtual world. But I think organizations have to really focus on that core culture and relationship nurturing that they're establishing with patients, and then determine how to extend that digitally versus just adding on digital functionality that's not necessarily going to provide a consistent experience to patients when they do come inside the facilities and receive treatment.
Kristen, one of the areas that I found very interesting is precision-based care and how CTCA has really started embracing that. I know that you're leading the charge for them. Tell us a bit more about the precision-based care and some of the positive results that you're seeing.
I'm happy to. This has actually been a very exciting area that I've become extremely passionate about. First of all, just to ground everyone in what precision medicine is, in the oncology area, it's the customization of healthcare or personalization where medical oncologists make decisions, treatment decisions, that are tailored to the appropriate and optimal therapies based on genomic testing and referencing scientifically documented research around genomic abnormalities that are related to the cancer tumor a patient has. Genomic testing identifies the DNA alterations that are driving the growth of a patient's tumor. And the precision medicine is really about the targeted therapies to address those gene mutations. From a technology perspective, our information services and our informatics department has aligned really in a very integrated but true partnership way with the physicians within our organization in our medicine and science division to ensure we're enabling physicians to have immediate access during the care delivery cycle to options that are appropriate and customized for that specific patient.
So in other words, what you're doing is you're personalizing the cancer care based on the patient's individual DNA, and then essentially you're making not only that personalization, but better levels of information available faster for the doctors. Is that right?
Absolutely. You know, this is really an area where the convergence of the scientific advancements in medicine and technology have come together to enable the computational work necessary to handle the volumes of data required to truly personalize treatment options for patients in a way that, when appropriate, as part of a patient's care, the physician can pursue that. So, you know, one of the things from a technologist perspective is that partnership with our physicians is necessary because physicians can no longer consume the amount of information being published the way that they did in the past, you know, if they got out of medical school 20 or 30 years ago. Right now, it's estimated that 1.6 million peer-reviewed journal articles are published per year. So even if you were to divide that by a specialty for any physician, to be able to consume that amount of information is impossible for a human. So we're really becoming a partner to curate and filter up that information so that our medical oncologists are empowered with the options that they can then discuss in partnership with their patients around what option would be best for that patient in the cases where precision medicine is appropriate for that particular patient's disease.
A part of precision medicine, are you also talking about using artificial intelligence, or maybe we'll even call it augmented intelligence, something like Watson, or maybe your own version of Watson that can take the very best data and tailor the data and the studies to the patient?
Absolutely. So I'm finding right now in the area of precision medicine that it's really a time of such rapid advancements in the developments in this area that everyone is really learning. And so that's the technologists, the healthcare providers, the scientists, but also any of the technology providers that provide solutions in this area. And so what we've done from a information services perspective and also informatics perspective is try to make sure that the approach that every vendor that has solutions in this area takes is unique to how they really curate, score, and provide those options. So whether it's their computational algorithms or the artificial intelligence, how that's been tuned to actually filter up results, that approach is different as you go across different solutions. So we have purposely tried to always challenge ourselves to find the best options and best solutions for our patients. And so that might mean that we look at multiple options on a continuous basis to continually challenge ourselves and see, are we seeing consistency in this area that's being developed? Are we seeing results that we feel confident in presenting to patients, and that being our clinicians, that they've earned that confidence and pass it on to patients? And third is that we're also seeing for patients that do participate in precision medicine, that our clinicians are seeing positive results that are really enabling them to benefit patients real time in the fight that they have with their cancer diagnosis.
I hear this, genomics is going to provide great results, and, we're seeing great results. Give me an example, or give the audience an example maybe of any studies or any sort of findings that you've had at CTCA. Is there something that you can reference maybe that talks about, what we can start expecting to see in terms of the types of results that genomics and maybe more personalization can draw out?
Certainly. So last year at ASCO, which is a large oncology conference, an abstract was published by Dr. Maury Markman, who's our president of our Medicine and Science Division. And it included results of 2 independent studies of patients at CTCA that had underwent next generation sequencing, or it's also known as NGS. That particular result focused on one series was 146 patients and the other was 99 patients. And it was looking at if they had received the genomic testing up front, would we have taken the same standard of care approach that we would have if we had genomic information? And as part of that, what we determined is in both series, they were within 1% of each other in results, that approximately 72% of those cases had actionable alterations as to the approach the physician would have pursued. And so as part of that, many of those patients did have their course of care altered as a result of that. But the long-term outcomes, we do not have anything published around that yet because this is an area of evolving approaches. But we're continuing to monitor that and feel very positive as an organization that this is providing very beneficial options to patients when appropriate for their treatment.
This is Dr. Steve Ambrose. As a healthcare influencer, I'm in contact with some of the brightest minds and most powerful leaders in the industry. But my best effort comes from outside the booth. Knowing how to engage patients is an art, science, and philosophy that I know very well. I'm a hired gun that brings expertise to healthcare organizations of all types. You've heard my words. Now read my thoughts on my free white paper called The 7 Mistakes Made in Patient Engagement. Just go to redhothealthcare.com/learn. That's redhothealthcare.com/learn. While you're on the site, dive into my consulting and speaking services and schedule an initial call. You won't regret the uniqueness, benefits, and results I can deliver for you. And now, back to the show. You talked about evolution. One of the areas that I'm real key on, I consult on it, is patient engagement. And I find there's evolution really needed in this facet of care, and that is the proper communication. I've found a lot of times when I speak to my clients, hospitals, health systems, often they're finding themselves running up against it when they're trying to get patients to follow through, whether it's drug adherence, whether it's providing patient-generated health data, working in the particular patient portal of their electronic health record. What I see happening a lot, and it may be because hospitals and health systems and other companies have never really had to deal heavy on the consumerism side, they tend to push information instead of maybe eliciting communication. And I guess by that, to the audience, I mean that they'll start pushing out, diabetes kills blah, blah, blah. Do you know if you eat this and this, you could lose this, blah, blah, blah. And, you have to give your data. It's so important because there's a so-and-so chance of lowering your blood sugar. And almost as if all the information, all the statistics, and all the technology that's important to hospitals and health systems as they have to measure up with, Medicare and all sorts of benchmarks, and they expect patients to just jump right on board, Kristen, and say, wow, that's just as valuable to me as it is to you. This concept of empathy and proper communication, it's still in a very early evolving area in hospitals and health systems. What have you found in terms of CTCA, in terms of helping patients, make key decisions or getting them to take certain actions? What sort of communication, steps do you all take and use?
A lot of the approaches that we take are just based on the philosophical belief that the patient's at the center of all care decisions. They're part of the care team. And in the end, any approaches or information or decisions about different options they were presented, what the pros and cons are, we really try to talk through and make sure a patient understands the pros and cons in relation to what's important for them in their personal life. So, for example, side effects related to somebody that is a piano player and hopes to play piano again might steer them away from certain treatments that might have side effects that perhaps could impair their pursuit of that talent. As we continue to customize those things, a lot of it is about the relationship and that two-way communication. In addition to that, we spend a lot of time focusing on quality of life. So when we talk about the pros and cons, some of the different areas of focus are around, for quality of life, say you're going to have XYZ side effect. So you just spoke about diabetes. If you're coming in for treatment and I talk to you about how diabetes is going to affect you and these are all the bad things that are going to happen to you, patients tend to shut off and not get engaged. If instead we talk to you about, these are things that are important to you. And by the way, maybe are you feeling cold? Are you feeling hungry at night? Or do you have this type of pain? Would you like to know how to resolve it? That's a different way to engage patients that sparks an interest and curiosity. And if you can start to deliver patient information and education in a way that makes them feel empowered, it tends to resonate more. Anyone dealing with a medical diagnosis, especially such as cancer, but any type of healthcare diagnosis, one of the things they often feel is a loss of control. They have this disease and they're now susceptible to it, and they're not able to control what's happening. The physician and nurses are handling a lot of that. They're on pharmaceuticals, but what do they actually do to take control? Yes. Trying to give information in a way that empowers them and makes them feel like they're actually taking steps towards getting better healthcare outcomes for themselves and improving their overall quality of life starts to create a different level of engagement that really creates hope for individuals that they can, either overcome the battle that they have or truly go back to a sustainable and happy quality of life post whatever particular disease they're struggling with.
Yeah, and you know what you're not going to replace either is no matter how much technology you throw in there, and I think you really hit on this too, Kristen, you're just not going to replace that human connection, which is why, we alluded to it earlier, is that culture. It's so important. I just can't say this enough that there's a big shift going on, even on an individual patient level. Doctors, hospitals, even drug companies, they've got to understand that you're dealing with people that more and more, if they're paying with their own dollars, they're going to look to eject out of the system. They're going to look to make this not important unless it's life or death. So I like how you get into the concepts of really relating it, not just the data, but then relating it back to what's important for them. Like what's their value? What's going to get them to pull a trigger? And that may just be certainly quality of life. You referenced that before. I want to talk a bit about Salesforce. I've actually brought this up with other guests. I like Salesforce. I used it in another market that I was in. Certainly, they're a huge leader in CRM. And they've been more of a recent player in healthcare. They're beginning to integrate and even compete with some of the traditional EHR offerings out there. How is CTCA working with Salesforce, Kristen? And maybe what have been some of the results from that?
So right now, we implemented the Salesforce platform last year. And over the last probably about 9 months, we've started realizing many of the benefits of the shift to that particular platform, which we leverage to facilitate our patient acquisition processes, physician referrals incoming to CTCA, and also our cancer fighters advocacy group. And that's through the community cloud functionality within the Salesforce platform. Electronic health records don't incorporate the functionality that exists in traditional customer relationship management systems. One of the things I've talked a lot about during this discussion is the personal relationships CTCA develops with their patients and how that's been important to our overall culture and creating that, the trust with the patient that really allows them to feel comfortable in our environment and focus on just getting themselves well, and allow us to take care of a lot of the other day-to-day tasks or distractions to really free them up to concentrate on getting healthy. And so as part of that, Salesforce allows us to start to understand a lot more about the patient. That's very important to CTCA. And not only the patient, but their caregiver. What are some of the favorite things that they like to do? Are there particular dates of interest in their life, anniversary, or maybe one of their children has an upcoming wedding, a graduation, different things they're looking forward to, that it's helpful for our care team to start to know so that as they're planning out different parts of the treatment journey for that patient, they can take those things into consideration, but they can also help celebrate them with the patient. So those are things that Salesforce has really brought from a functionality perspective to CTCA in ways that traditional healthcare electronic health records don't offer.
It's very clear that Salesforce is hitting on something that's been missing for quite a while.
Yes, it really helps propel organizations that are wanting to truly develop a strategy around consumerism, because when you bring a CRM into a traditional healthcare environment, it enables you to start to understand and track and respond to all of the different factors that we find, things that are important to all of us as consumers in other industries, have traditionally been ignored in healthcare. Well, when you start to open yourself up as a healthcare provider to understanding what those things are, it's just like if I travel a lot, so my hotel preferences, whether it's or airline preferences, what type of seat I'd like, pillows, do you want your hotel room close to an elevator or not? All those types of things that are captured and often built in automatically to the room assignments, we traditionally have ignored in healthcare. Well, with CRMs coming in, we're finding that patients expect their healthcare provider to not only deliver and touch on those types of items that many other industries do, but they're trusting us often with life and death care delivery services. And the level of relationship that takes really requires a deeper relationship than a very transactional relationship that existed in the past.
So apart from CTCA doing the direct work, certainly with patients and being on that cutting edge, you also have just reached out to partner with Allscripts and NantHealth on a custom oncology treatment program. Tell us a little bit about that if you could.
Yes, in December 2016, we actually went live with this solution, which is Evity Advisor is an oncology clinical decision support solution that's part of NantHealth. NantHealth and Allscripts had a established partnership, and Allscripts happens to be the electronic health record that CTCA utilizes. And Evity Advisor is well known and heavily used within the oncology area. Approximately 65% or plus oncologists throughout America utilize this tool. It ends up being a tool that externally is referenced outside of the electronic health record. And what I have learned is if you cannot integrate the work for a physician right into their workflow when they're making care decisions for a patient, that oftentimes the value of these different solutions is not maximized. And the patients don't benefit and get the value in the way that the healthcare provider or their physician truly hope that they will. So we wanted to change that, and through discussions and what ended up being a very successful collaboration between CTCA, NantHealth, and Allscripts, we were able to create a custom technical solution that truly integrates Evity Advisor within our electronic health record. So the physician can, at the time that they're ordering, access the clinical pathways that are offered through Evity Advisor, evidence-based clinical pathways, that we have then mapped to CTCA's order entry system so that there's been no changes there for the physician. That's been consistent, but they have access to these pathways now that suggest treatment regimens specific to each patient based on their health and specific disease state. In addition to that, which is really revolutionary for our physicians to have at the decision-making stage, and I think any oncologist, is not only comparisons between treatment options, meaning different types of combinations. So something might be chemotherapy and radiation. Something else might be chemotherapy and surgery, and certainly differences in pharmaceutical approaches might be in each of those treatment options. And they'll often come with a recommendation as to effectiveness that can be expected from each of those options based on the specific patient. But what it's actually brought in addition to that, that's really powerful, is average market cost of delivery of each of those treatment options. So for a physician who historically has not been empowered to be a good steward of the healthcare system, we've tried to bring that in a way that really empowers our physicians that if they had clinically equivalent options for a patient, and maybe one option is 10x the cost of another, that could be something that they're aware of and consider in that decision-making process, and also can make, as we always try to involve our patients in the discussion around the treatment options that might be appropriate for them, that physician has the ability to then discuss that also with their patient. So that has, with the shift to value-based care and all of us really focusing on being good stewards of the overall healthcare system, this was one of those really powerful pieces of functionality that truly has differentiated the approach, I believe, for our physicians at the point of care within the EHR.
On a personal note, Kristen, what's one thing that you feel very strongly about that most others disagree with you on?
Well, I think what comes to mind immediately is around the speed of change that's occurring related to digital and the commoditization of technologies. The rate of technology change in digital is having truly exponential impacts that no longer follow Moore's law, as most of us have always referenced in IT. It's driving disruptive changes that are going to affect all industries. But if I look just specifically to healthcare, in our business models, I think it's going to be extensive in the next few years around how healthcare is accessed, how it's delivered, and even how conditions are diagnosed. Individuals will become much more empowered to make decisions and also have tools accessible that today you have to see a physical healthcare provider for. You'll see many of those things continue to become accessible to consumers right on their smartphones with a level of accuracy that today many of our healthcare provider facilities provide. How fast that change will happen, I think, is often an area of disagreement, but I think within the next 5 years, it's going to be very transformational. And if you look 10 years down, I think it's going to be incredibly disruptive to the way that we see healthcare today. But with that, I will say one of the things I believe wholeheartedly is, as much as digital is creating disruptive ways for many industries to deliver their products or services to customers, or in healthcare to patients, if you look just in healthcare, the replacement of the human touch and the relationship and truly trusting someone when you're facing a life and death decision around who are you going to select to care for you and who are you going to select to receive treatment from to fight this disease. I think the human connection will never be replaced by digital. It will just become a supportive enabler to hopefully make our healthcare system not only much more effective, but also continue to drive the cost down.
Kristin Darby, Chief Information Officer of Cancer Treatment Centers of America. Kristen, I want to thank you so much for making the time today on Red Hot Healthcare. I've enjoyed it, and I look forward to hearing some great things in the future for CTCA, as well as yourself.
Well, thank you very much, Steve, for having me. I appreciate the opportunity.
You've been listening to Red Hot Healthcare with Steve Ambrose. Subscribe to us on most major podcast directories. For media or business inquiries, reach out to media@redhothealthcare.com. Thanks for listening. This is Denny Colonna. We're out of here.